Hello everyone, my name is Dr. Agnivesh Tikoo and I am a spine surgeon at Apollo Hospitals, Navi, Mumbai. Today I am going to discuss with you about spondylosis. It is a degeneration or a wear and tear which affects the spine. We hear this term commonly on internet websites, on various even medical examination reports which are there, and there is a bit of apprehension which is associated with this term. So I am here today to take away that apprehension and tell you that spondylosis is nothing but normal wear and tear in the spine. It is a degeneration which happens in the spine, and resultantly you may get some neck pain or some back pain. Since there are nerves which are closely associated within the spinal column and the nerves come out from it, there is a possibility that spondylosis can irritate or compress one of these nerves, and which can lead to a pain going into your arms or going into the leg, which we commonly refer to as sciatica. But most of these problems can be very well managed by conservative therapy. By conservative, I mean a short period of maybe rest, some medications, some supplementation, and regular exercises and posture care. So that is all what you need in more than 90-95% of the patients. So let's try to understand that what is this spondylosis or what is this degeneration. Now, to make you understand that better, I have got a spine model with me here. And as you can see, the spine is not a single structure. It is a chain of bones like these bigger blocks, which are separated and joined together by this soft structure called as disc. So these discs are gelatinous sort of elastic bands which sort of provide the flexibility and the movement in the spine, and they are very closely associated with these nerves which come out and supply the sensation and power in the hands and in the legs. Now this disc essentially consists of two layers or two structures. The outer one is a tougher layer which we commonly refer to as annulus fibrosus, and the inner one is a gelatinous or a jelly-like substance which is called as nucleus pulposus. Now this gelatinous or a jelly-like substance has a property to soak up water, and as it soaks up water, it swells up to become a tight sort of a cushion, like a tube inflates a tire and keeps it taut. It's that water which sort of keeps this disc taut and keeps it well supported so that it can help the function of movement of the spine and also provide the proper space for the nerve to come out. But because of multiple factors, it may be a mechanical insult, it may be bad posture, there are genetic considerations which have to be taken into account. There are work habits which are there, very heavy work, or even sedentary lifestyle and sitting work for long hours is associated with back pain and degeneration. Vitamin deficiency like vitamin D deficiency is very commonly associated with back pain and disc degeneration. So regardless of the fact that why the disc degenerates, it eventually loses this property to hold water. So there are cross linkages in the substances between the disc which actually hold up that water. Now when those cross linkages break, they sort of are not able to hold up that water, and resultantly the disc becomes less settled and turgid. It loses its elasticity and tautness, and that is what sets stages of dysfunction of the disc, where first you get a stage of dysfunction where you get pain. Usually it is believed to be started by a torsional injury, but eventually all the disc degenerations go to the same stages, and then there is a stage of instability where because of this disc getting settled and weak, there's a micromotion instability which sort of happens instead of a regular smooth hinged movement which should have happened. That wears the disc more and wears the joints which are present on the back side of the spine, which we call as the facet joints, and they sort of start giving additional pain. And then later on, body has its own mechanism. You start getting some osteophytes, which is the bone growth, and the spine or the two levels try to stabilize together so that this abnormal movement can be stopped. So this is called as the stage of restabilization or the stage of stabilization. So this is what happens in a degenerative cascade, and this is why you get back pain. Now you must have known all of this by various names like herniated disc or a slip disc or or spondylosis or degenerative disc disease. Essentially, all of them do refer to this same cascade, which is brought down by a mechanical insert or by anything like genetic or any vitamin deficiency. They all play a role in all the disc degeneration, and eventually they undergo through the same cascade. So now the question arises that what can we do to prevent it and what can we do to avoid it? To be very honest, the spondylosis or the degeneration starts the day we are born because discs do not have a repairing capability. They don't have any blood supply. So once they degenerate, they sort of tend to degenerate more and more. They sort of go into the cascade. It's like graying of hair. Once it starts, it will sort of slowly take its own time and take its own pace to go over there. What we can do actually is that we can sort of delay that degeneration, and our aim is to have a healthy and sort of supportive spine, and we need to outlive our spine. That is the basic aim of sort of preventing or sort of keeping all of this under control. So what can we do to help this? Now, the first thing is that keep your posture upright. A lot of people these days are doing work from home and they tend to work in abnormal postures for a very long time. They keep on sitting on chairs or in bad sofas or something, holding their laptops in their lap for a long period of time, like hours, 6 hours, 7 hours, 8 hours. So all of this will cause back pain. All of this will sort of accelerate the degeneration, what it is going on. So we should have a proper work-related sort of a working table for you, which you use as an office table in your home. Your ergonomics need to be right. Your sitting posture, everything needs to be right. And people who are working long hours on computers, we usually recommend them to have multiple working stations, like a sitting station, a standing station, which they use while standing. And also they can use the same station with a heighted chair, like a bar stool or something like that. And alternate between these stations, change them every half an hour, 45 minutes or 1 hour, so that you can work in multiple sort of setups or multiple stations and avoid sitting in one posture for a long time. If you do not have that option, please take frequent breaks after every 30 to 45 minutes. Just if you get up from your chair, walk inside the room and just sort of mobilize your shoulder joints and sort of just do a bit of mild some stretching or some exercises, very minimal stretching, not excessive stretching. That's another point which I'm going to talk about. So this will take care of the sort of back pain which you are developing or which you are going to sort of have it. Now, there are certain exercises which we tell people to avoid. One of them is overstretching. So what happens is that as these discs degenerate, they sort of become less and less elastic. So what would happen if you try to stretch a rubber band? It will break. So that is what happens, that if you try to do certain exercises which involve hyper flexibility or something which involves too much of stretching or twisting, there is a likelihood that you may injure your disc, and then the back pain starts, and then it sort of may go out of hand also if it's not curtailed at that point of time. So you can do exercises regularly. You should do exercises regularly, but probably say after 30-35 days, nothing which you will gain by overstretching or doing over flexibility exercises, because body tends to become more and more stiffer by that time. And I personally believe there is no point of fighting against that stiffness. You need to respect that and be as flexible as you can, but don't try to overstretch or do exercises which involve too much of doing this. In gyms and all, the deadlifts with weights are the worst exercises you can do for your spine. They are one of the major reasons people present to us with back pain and with slip discs. They have just done a deadlift or a squats with heavy weights on their shoulders and all. So they are the worst exercises you do for your spine. The best exercises for your spine are free hand exercises. You can do some light weights holding in your hands and all. But these type of exercises where you're doing heavy deadlifts, heavy squats, these are not really good for your spine. You should aim at daily walking for 30 to 45 minutes. I understand there are situations right now which we are going, there may be lockdown. So you need to reciprocate that type of thing within your home. Maybe you will not have visitors also if you have lockdown. So probably what you can do is you can sort of condense your living room furniture and make a walking track around it and keep a tab of daily walking that you can do. And vitamin D is a very essential vitamin for your bones and muscles. Ideally, we should check it, and if it's low, we should start supplementation. After supplementation, we need to take a maintenance therapy also for this. Otherwise, it will tend to become low and low. Mind you, vitamin D we get by sunlight primarily, and if you're not exposed to sunlight, then the chances that your body will have vitamin D, adequate vitamin D, are less. And that sunlight exposure has got specifications. It has to be between 11 to 2 p.m., sort of that sunlight where your shadow is not longer than your body. Preferably 40% of your body area exposed, and maybe 10-15 minutes of exposure is good enough to make vitamin D. But when I'm telling you all this, we do realize that probably we are not going to get that level of sunlight once we are working indoor and all. So that's why it's essential to keep a check on vitamin D and take adequate supplementation for that. Thank you very much.